Okay, Dr. Anam, I think you never entered in part 3 MRCOG before, and even in MRCPI, because they are very close to each other, but you entered another European board exam. But I think you know how to deal with the scenarios and how to deal with the stations. So first of all, I was not expecting it because I don't know much about this European board, how the exam is, but it's the same looks like. So most of the membership exams are not very different from each other. So it's good that you know how to deal with the station. So I want to know, first of all, how you tackle this 2 minutes. What you have written, what are the issues that you recognize, and then you want to talk about it. Can you tell me about your bullet points? Dr. Anam? Dr. Anam, your mic is closed. Sorry, let me share my screen again. Yeah. Dr. Anam, are you there?
Yes, doctor, I'm listening.
Okay, so how you dealt with your 2 minutes?
Yeah, it's good time, really, 2 minutes in this case, but in MRCOG we have only 1 minute, doctor.
Yes.
It was confusing, really, because I know about this case, doctor, really, because if it's a repeated case, it will be easy for me, but if it's a new case, it will be some shock.
So it is a recall, actually, and most probably, like, it's not a new topic. So the people who are going for obs and gynae exam, they know about it. So what are the issues that you have written in your bullet points? I want you to tell others also.
Yeah, so I wrote the name because I need the name. I wrote the age, but I miss Pap smear for the age. And I wrote the ultrasounds report. But so I guess that's ultrasounds. It's a second trimester ultrasound, but there is no gestational age. So I wrote certain point. I wrote fetal medicine for me. I wrote the blood group, and I wrote termination of a pregnancy.
So the referral, so you wrote where you are going to refer to fetal maternal, yeah?
Yeah, because she wanted.
Yeah, and you wrote your point about termination of pregnancy.
Yeah.
But what about if she want to continue, then how you are going to follow up? Did you write this point also?
Yeah, I wrote two arrow. I put two arrow. One of them termination and one of them like that. I put in my mind there is two ways.
Yeah, yes. So you knew it that you needed to talk about, even if she want termination of pregnancy, but you still need to talk about continuation of pregnancy and how you are going to follow up if she want to continue.
Yeah, correct.
Yeah. Okay. So let's see that the issues is, the first issue is that she's very young. She's not a teenager, but she's a young adult. So you need to explain her, and maybe she's very impulsive, emotional, and you need to know the background also. So there are some points that is related to her age, that why she want termination of pregnancy. She told you by herself. Actually, the role player was good. She was directing you what she want, what is written in her, feet. That will give you the marks, a mark sheet. What I mean. But anyway, even if she will not ask you, you have to ask her that her background, what she know about fetal talipus, and if she, why she want termination of pregnancy, what's going on in her mind, why she want it, and the other thing is that, so she need to be counseled also, that maybe she has an idea. You want to know the idea, what is in her mind, that maybe they are disabled. She said also that the baby will be disabled and she cannot deal with the disabled baby, isn't it? So, and you have to like tell her that I'm not forcing you any idea, I'm just giving you information, but the final decision is yours. So you need to talk with your partner and then take your time, come back. I'm giving you another appointment with the consultant. You always have to say that. I'm giving you another appointment with the consultant. You go and I'm giving you patient information leaflet. You go and discuss with your partner, read the patient information leaflet, and come back with the and talk with the consultant and then decide. Yes. So yeah, these are the things in bullet points that you can write. Welcome, Dr. Bushra. So Bushra, I want to show you something that we have just done this scenario of fetal telepus, the girl who won termination of pregnancy. So we were talking about this. Dr. Anam has done it, and we are talking about the model answer of this case, this scenario. So yes, after introduction, confirming her name and age, ask her agenda, like what she like to discuss in this consultation, because some people might think that she want to talk about the explanation and how the fetal telepus looks like. She already know, and she already seen maybe most probably an obstetrician gynecologist. So she has already seen someone, and someone already explained to her, and she knows about her diagnosis. So, but she is here for the management, like what she think is right management is to do termination of pregnancy. This is, so it's a counseling station actually. So briefly, you have to tell her what information that you have, and then as if she has any other concern. So ask her if she have any other concern she wants. So her agenda, what is in her mind about this consultation? She want to discuss about it, or she has something else in her mind also. So after you ask her what she want, then you can take the targeted history. Now, if the lady is pregnant, you always have to ask about her current situation. Like she's 20 weeks pregnant, so you can ask about the fetal movement, if she has any abdominal pain, which is called history of presenting complaint, right? Any bleeding, leaking from down. And then you have to move to the beginning from the start of pregnancy. And then you can start with, as you ask, it is planned or unplanned. Um, and is it spontaneous? You can also add that because this was unplanned pregnancy, so the question of spontaneous or induced is out of questions. So after she will tell you that it's unplanned, that you can skip the other spontaneous or induced pregnancy. Now, the other question that you asked is if she used folic acid or not is a good question to be asked, because it's unplanned, so she didn't use it before, but she used it after. And if she has done her initial the another ultrasound of anti-scan, and she has done all the blood work and urine blood workup also, and all the other investigations is done or not, and how was the result. So it is, I think, important to know that her aneuploidy screening or Down syndrome screening was done, and what was the result, because if there is any chromosomal abnormality related with this structural problem, then you have an idea that how was the result initially of her NT and combined test, her anomaly screen, her aneuploidy screening result. So it's important to ask also. So yeah, ultrasound first trimester, and she already had her detailed scan and anomaly scan. And you can say that I want to review your scan to see if there is no other abnormality. No abnormality. You should not use the word abnormality. There's no other problem. Use the word problem, not defect or anomaly or abnormality, because it's not nice to say abnormality. Just say problem. So and then you can ask her that if there's any problem during pregnancy, and if she was following with the midwife or not, and how was she was regular, she was compliant, she was a compliant patient, because this is an unplanned pregnancy and she is very young. So I think it's also better to ask if she is compliant patient or not. Then you can come, like you ask the history, her health, medication, allergies, family history of any babies with some problems or with the defects. You can ask about, like you ask about her smoking, alcohol, drugs for fun, and support at home, and even you ask about the questions of depression, her mood, which is good idea, and if her partner is supportive or not, and what she's doing. If she, because she's 20 years old, keep this in mind all the time. So if she's a student or she's working also, and with whom she's living, all these questions. Social history in a 20-year-old young girl is important. So she is primary, so she has no obstetric history. So after taking history, you need to counsel her regarding your knowledge of telepus. Like it can happen in 1 in 1,000 babies. Like it's always a good idea to give some stats, but if you don't have these stats, it's okay. So you can say that it's not that common, but um, but you have to tell her that there might be like it might be due to the shape of the womb, her womb. Maybe the baby is sitting, that's why it has pressure on the legs, and that's why it happened. Or maybe there is less water around the baby, so I want to review the ultrasound to see how the water is around your baby. It can affect feet or both feet also, and it might be an unknown cause. It might be related with some of the chromosomal problems, and it might be a part of the syndrome, like many defects together. So there might be, like I said, that there might be genetic factors involved. Like there is 3 to 4 in 100 chance that it might be related with other chromosomal or genetic problems, and it might be associated with other um, problems in other parts of the body, because of course you are talking to the patient role player, so you cannot use the medical terms, so you have to use the um, like the layman terms. So you can say that it might be that there might be other problems in, like the problem in joints, backbone, or other problems in other parts of the body. So I'm going to refer you to a specialized doctor team called fetal-maternal specialist, and they will do the more detailed scan and will tell you clearly about your options. So, and then tell her about that they are going to do the needle test also that will rule out chromosomal problems. If she doesn't know about needle test, just tell her about, because you have to tell her that about amniocentesis, that in her language, that what is a needle test, that these specialized team of doctors, they are going to do it. So they will take some water around the baby, and they can do it like from the tummy and from down, most probably from the tummy, and they're going to numb the skin, so you will only feel the pinch. It's not very painful, so you are going to feel a pinch, and after that they will take some water around the baby, and they will send it to the laboratory um, to find out that if there is no other chromosomal or genetic problems. So there is a risk that 1 in 100 risk that the baby might have like of not abortion but miscarriage. Yeah, so there is 1 in 100 risk of miscarriage because as a result of this, and but don't tell her about all the detail about this one, but I think this at least one risk you have to tell her about, the risk of miscarriage. Yes. But at the end, we will know for sure that there is no chromosomal or genetic problem. After the detailed scan, it will be clear also that there are no other parts of the body involved. So tell her that needle test will be done to rule out. Okay, if she insists for termination of pregnancy, which is her right, but before this, tell her about the fetal TELEPS. Like maybe it is isolated, like there is no other problem, there is no other chromosomal problem, and it just happened for unknown reason. So if this is the case, then the prognosis is not that bad, and maybe the baby might need surgery, or might need some special boot, and it's not a big disability, but if the baby surgeons think that the baby needs surgery, it will be done, and the baby will be able to walk later on, maybe with some support or with some special boot. So they are having normal life expectancy, and they are doing all their they are living their life. And some babies might need surgery, and some babies might need some only a little bit support, and they can live individually. So there is no mental problem associated with it, like IQ problem associated with this problem also. So they are doing well in school as well. So, but if she still insists for termination of pregnancy, which is her right, then you have to tell her that you can do it up to 24 weeks. But as you said, once it approached 22 weeks exactly, we need to give you an injection to the baby's heart so that the baby will not be delivered alive, because it will be difficult for you. If she decides to continue, and it's an isolated defect, then tell her that it might be mild and will not need any surgery, and if needed, it can be corrected surgically after delivery. So, but MD team talk about team of specialist doctors will talk to you, and I'm going to refer you to that special team of doctors that will tell you about the prognosis of this baby after delivery. Okay, so baby surgeon, pediatric surgeon, and the bone specialist. So it will be a team of specialized doctor with fetal-maternal, the pediatric surgeon, and the bone specialist, including actually fetal-maternal also, of course. Fetal-maternal physician, baby surgeon, and bone specialist. She can tell her that we are going to follow you up. We are going to do regular scans for your baby, and she can deliver, need follow-up scans, and she can deliver vaginally and spontaneously at term, and it should be an obstetric unit, so that there will be a team of doctor available after delivery, and give her at the end patient information leaflet, support groups, and offer her next appointment with consultant. So this is usually how you deal with the scenario, for the whatever the case is, if the lady is pregnant. So you start talking about the now the current situation, and then from the start of pregnancy until now, which is 20 weeks, and then from 20 weeks onward until delivery, and sometimes even after delivery. Then you need to, like this one, after delivery, how the baby will be, what will happen to the baby. So you need to talk about even after delivery. So this is how you take up any case who is pregnant. So any question, Dr. Anam, or anyone?
That's clear.
Anyone? Dr. Manikam, you just, and yes, Athil, yes, please.
Yes, doctor. About the cause of abortion. About the cause of abortion, it is under, is it under clause F, congenital anomaly, the cause of abortion?
I don't think so, because
or social,
yeah.
Because if it is under the cause of congenital anomaly, there is no limited gestational age.
That is true. That is true. But if it is an isolated case, it all depends after the result of, if there is an other structural defect. So if it's part of the syndrome, then it might be under the clause F. But because if it is isolated, then it cannot be clause F. It will be social.
Yes. Doctor, I think clause F only if it is fatal or handicapped baby.
Yes. So I don't think fetal thalipus.
Yes. It is the baby will deliver. It can be treated.
Yes, it can be treated. Yeah, it's not something that have severe handicap or threaten to life, that the baby will not be alive, or baby will be severely physically or mentally handicapped. So this is not the case here, if it is isolated, because we don't know yet.
Yes, doctor, another question. In the discussing of ultrasound report, do we need to check her name and NHS number, or because she know about her ultrasound report,
yes,
we do not need? This
Yeah,
is under
if she is, yes, it is very important.
patient
If
safety.
you want to discuss, this is part of patient safety. If you are about to discuss about the ultrasound report which says some structural defect, then you have to confirm. Like if I am writing here that you have to discuss with her, you have to inform her about her report, then you must confirm her name and her hospital number, and then you proceed and you tell her that this is your ultrasound report. But here she already knows about her ultrasound report,
Yes.
and she's just coming to discuss, and you need to counsel her only. So
Yes.
yes, but if this is the first time you're informing her, yes, it is part of patient safety that you must inform her about all these things, that this is your name and this is your hospital number. I'm just confirming because I'm going to tell you about your ultrasound report. Yes, this is part of the patient safety in that scenario, in
Yes.
breaking bad news scenario.
Yes.
Anything else? Okay. So it means that we can move to the next scenario. And who will do the next one? Let me start my clock, 2 minutes. So who will do it? So the people who attended November exam can try to do it. And the people who attended at least like MRCPI exams, they can also try. And anyone can try actually. There is no fees for trying.
Shall I, ma'am?
Oh yes. Dr. Manikim, you want to try?
Yes, ma'am.
Okay, go on. So let me show you the other scenario. Now I'm going to give you 2 minutes. Okay,
Yes, ma'am.
it's starting now.
Ma'am, is the time over, ma'am? Ma'am, shall I start, ma'am?
Okay,
Yes, ma'am. Hello.
it is
I am
actually 7 seconds remaining, but it's okay. We can start.
Yes, ma'am.
Mhm.
Hello.
Okay,
I am Dr.
10, your
Monica.
10 minutes are starting now. Start.
Yes, ma'am. I am Dr. Monica, doctor in clinic today. May I check your name and age, please?
Yes, doctor. My name is Darlene Delsey, and I'm 30 years old.
Do you? How do you want me to call you?
Darlene is fine, doctor.
Okay. Darlene, you're at the 12 weeks of your pregnancy,
Yes,
in your first pregnancy, and you've come to discuss about your reports. Am I right?
Yes, doctor. Is everything okay? I don't know why my midwife, I was following with her, everything is fine. She just sent me to you.
Any other concern you want to discuss today?
No, actually, I'm fine, and actually, I'm very excited about my pregnancy. So I become a little bit worried, actually.
Mm. Mm. So, you have, I have to, do you want to know the result first? If you're very anxious, I'll tell you the result first, or after asking some questions to know more about you, then we can discuss about your management options and come to a shared decision.
Yeah.
What is your
You can
idea?
ask me, doctor. There's no problem.
Okay. Is it, please tell me more about your pregnancy so far,
Yeah.
darling.
So, doctor, me and my husband John, we were planning about this pregnancy, and I was using folic acid like 2 months before my pregnancy happened, and then I use it until now. Like I'm still using it, and I think I need to stop it. But you have to tell me when should I stop. And you know they have, my midwife has done some initial blood test for me, and the result came, but she didn't tell me, of course. And the ultrasound also was done, and the ultrasound was fine. There's no problem. But about the blood test, she didn't tell me actually everything about it. So I had like some. I still have some nausea, but there's no vomiting.
Do you have, did you have the down screening also?
Yes. So this part she told me. She said that your down screening, the scan, and the blood test all came back as normal. She told me yes.
Okay. Mm. Do you have any pain in your tummy?
No, doctor, I don't have.
Any discharge down below?
No, doctor.
Any uh, blebs in the down below area?
No, doctor, I don't have.
Okay. Mm. How about, this is your first pregnancy? Have you, before that, I want to know about your periods. Tell me about your periods.
Yeah. So actually, doctor, I was having regular period. I never had problem in my periods. And
Are you,
and and this is, I'm like, I know that I'm 12 weeks pregnant.
are you up to date with cervical screening program?
Yes, yes, I did it a year ago. It's normal.
One intrusive question, shall I ask you?
Oh, okay, doctor, go on.
Have you ever been treated for any sexually shared infection?
Yeah, once I had chlamydia, and I was treated for this, and then they checked me again, so it was gone actually.
At that time, you were with your partner?
Not with the current partner, with another one, doctor.
Okay, okay. And okay. Do you have any other medical condition for which you are treated by GP?
No, doctor. I'm
Any
fine.
allergies?
No, doctor.
Any surgeries in the past?
No, doctor. I don't.
Do you smoke?
Yeah, I used to, but I stopped
Good.
after I decided that I want to get pregnant. I stopped.
Good to hear. Do you take alcohol?
No, doctor. Occasionally, you can say very occasionally, but now since 12 weeks, actually once or twice only.
That also, if possible, you can stop. That will be good for your
Yeah, I
pregnancy.
can because
Okay.
it's not, I'm not dependent on it.
Pardon me, any recreational drugs?
No, doctor.
Are you aware of your weight to height ratio?
Yes, it's a 25.
What about your partner? He's very supportive.
Yes, he's very supportive.
What is he doing?
Yeah, he's working in one of the private companies.
What do you do for a living?
Yeah, I'm working in the same company, doctor, as a secretary.
Okay. Do you feel down depressed for the past 4 weeks?
No, doctor, I'm fine. I'm very happy actually.
Do you know your blood group?
Yes, it is A positive.
Have you ever had any blood transfusion?
No, doctor, never.
Okay. Anything else you want to add?
I'm just a little bit anxious. Otherwise, I'm very fine. I know
Thank
that everything is fine.
you.
But if you can tell me about my result.
Thank you, darling, for your his, information you have provided. I want to examine you in presence of chairperson with your consent. The blood pressure, heart rate, and temperature will be recorded by the specialist nurse. Have you ever had any urine infections?
Oh, once or twice in my life, but not too much.
So I want to have a examination of your tummy and the down below area for any blebs or not.
Okay.
Then I have verified your name, NHS number, and age with your report. Anybody told you about the report?
No, doctor, they just send me to you.
It is a concerning news. Shall I ask this question? But it is not, but you have to be alone to receive this report. I can't call the specialist nurse to be with you for support. I'm really very sorry to be the bearer of this news. You have a condition called HIV positive. This
HIV? Doctor, I know this virus. It's very bad. How can I have it?
You had one sexually shared infection, no? Like that. This is also a sexually shared infection.
So you mean that this is possible that it is transferred to me during sex, the same way like I had chlamydia before?
It can be. It can be even spread by some blood transfusion or by injections or by sharing needles while taking drugs. But you are not having that habits and all. But as you think, it is not a very bad thing. It is treatable. It can be kept under control. And the people taking regular treatment, they have a good
Doctor, I
lifespan.
know that once someone has HIV, it's not going away from the blood. It stays there all the life, and it can have consequences, isn't it?
You're right. But some people, there is a group called elite. These people, they do not need treatment, but they may have the disease. And they have this is one group with good immunity. But most of the people, they require treatment, prolonged and the continuous follow-up by the specialist group of doctors. And one more thing, has your partner also has to be tested. Do you use any condoms now?
No, doctor.
This is a. Shall I continue, or you want to take some relief from this shock-like news?
No, doctor. Please continue. I want to know: is there any harm for the baby?
There is a chance of this being transmitted to the baby through the after birth. So you have to take treatment also. Before that, you have to inform your partner also. If you are very reluctant to inform, this will be done by the department itself. He'll be asked and to undergo the test to find out.
So you mean, doctor, even if I don't want him to know, you are going to inform him?
He'll be tested, and it is better to inform him as it is. He will be the stake of infection. No, he'll be in danger of infection if you are not telling. So it is better to you to inform. And if you are not willing only, if you are very reluctant, it will be done by the medical people, and he will be tested also. If he is already positive, he will also be treated. And you'll have your care will be under the group of specialists, including
So
me.
I want to see that how much time more you will take. So 10 minutes pass. I'm giving you 5 minutes.
Sorry, ma'am. So
you can continue. I want to know how you will deal with this patient.
You'll be offered treatment by the group of specialists. You'll be given so many investigations will be done. That is the load of the count of the viruses in the blood that will be taken, and the liver, how the liver is working. These tests will be done. And you'll be after verification of this in full blood count, everything will be done. After that, you'll be started treatment according to the number of viruses in the blood.
Okay, doctor.
Better to start with the second trimester, that is the within the 5 to 6 months of pregnancy. Then you'll be sent to the sexual health clinic to rule out other infections also, if any present, that will also be treated. And this treatment will be monitored by periodic, every time you take blood, this viral test will be this is caused by a virus, no, this count will be tested in every once in 3 months and at 36 weeks of pregnancy and just before delivery also. And your delivery also will be according to the number of this viruses. If it is less than 50 per ml, then you will be offered, if there is no other indications, you'll be having a vaginal delivery. Otherwise, you'll be offered cesarean section to prevent the baby getting the infection. And during everything will be, the care will be in the consultant-led unit. You'll have the usual other tests like this 18-week scan, then if you have some growth defect of the baby, growth scan, everything will be conducted periodically. And the discussion of delivery will be at 36 weeks. And after delivery will be conducted in the consultant-led unit with the adequate precautions, this pain relief, one-to-one care, continuous support, everything will be given. And after delivery, the baby will be handed over to the baby doctor and you'll be given injection to reduce the bleeding, and you'll be advised not to give breastfeeding.
Oh,
as
so I
breastfeeding,
cannot breastfeed, right?
yeah, and according to your viral number of counts of this virus in your blood, the baby will be given particular type of medications to
So
prevent the baby.
doctor, the baby can be infected, right? How bad is the chance?
There is a chance of, if you take the treatment adequately, the chance will be very much less. Otherwise, it will be more. It will be about, it is not on the top of my head now. I will tell you during next visit. And then the baby will be given treatment. Do not worry. And the baby will be kept under surveillance up to the 2 years. And your partner also will be given. I'll give you the patient information leaflet, everything I'll give you. You'll talk to him and I'll write back. If this will be kept confidential without your knowledge, it will not be told to anybody else. If you don't want, it will not be communicated to your GP also.
Okay, I will come back with my partner. I'll discuss with him. I will tell him. I'll come back with him. And yes, thank you very much.
Thank you so much.
Okay.
I've taken so much of time. Sorry,
4 minutes more. I will tell you why you took 4 minutes. You know it already. No, it's 3.5 minutes more. It's not 4 minutes.
Okay.
So what I will do now, before I give you the feedback and the model answer of this scenario, and then we will discuss about it. So my third and last part, I'm going to send you invitation also. There's one more girl who want to join. I'll send her the invitation also. Let me stop here. And